So first, thank you to all our presenters for your valuable time and excellent presentations. We really appreciate you spending it with us on your weekend and contributing to the 11th anniversary of EDS Canada hosting the Canadian Ehlers-Danlos Syndromes Conference. My name is Jacqueline Raposo, and as some of you know, the Executive Director of EDS Canada Foundation. To recap what was shared today, Dr. Maxwell described how the complexities of hypermobile Ehlers-Danlos syndromes, or HEDS, and hypermobility spectrum disorders, HSD, necessitate improved diagnostic criteria and a comprehensive approach to treatment. He highlighted how collaboration among organizations is key to refining understanding and management of these disorders. Dr. Maxwell highlighted the study involving 100 postural orthostatic tachycardia syndrome, or POTS patients, revealing a strong correlation with HSD. Among them, 13 met strict hypermobility criteria, while 34 met HSD criteria. His PENTAD concept illustrates the interconnectedness of HSD, dysautonomia, including POTS, mast cell activation syndrome, or MCAS, gastrointestinal issues, and autoimmune diseases. Dr. Yelman's presentation emphasized the significant overlap between HEDS and myalgic encephalomyelitis, chronic fatigue syndrome, or ME/CFS, highlighting common comorbidities such as POTS, MCAS, small fiber polyneuropathy, gastrointestinal dysmotility, central nervous system complications, and vascular abdominal pathology. He explored the relationship between HEDS and ME/CFS and noted a significant overlap between the two conditions. He also addressed the exaggerated sympathetic nervous system response often seen in MCAS and its management strategies. Dr. Yelman highlighted the complexities of EDS, the art of medicine, start low and go slow, and the importance of understanding its potential complications for providing comprehensive patient care. Beth Pollock's talk focused on hypermobility, connective tissue disorders, long COVID, ME/CFS, and related disorders, noting common symptoms such as extreme fatigue, cognitive impairment, and orthostatic intolerance, which affect multiple organ systems and lead to complex medical presentations. She shared preliminary data that emphasized the role of infections as triggers for these illnesses, with a specific focus on severe acute respiratory syndrome coronavirus 2's long-term effects. Her research highlights the need for further exploration of how these illnesses impact reproductive health and the link between infections and conditions like endometriosis. She underscored the importance of comprehensive research into spinal conditions, advocating for non-invasive diagnostic approaches and a collaborative multidisciplinary strategy to better understand and address these overlapping health issues. Beth calls for increased dialogue among researchers, clinicians, and patients to improve diagnosis, treatment, and the overall understanding of these complex conditions, aiming for a healthcare model that incorporates early screening and patient advocacy. As we just heard Dr. Daniel, she spoke to the challenges for patients with EDS and HSD concerning issues with being heard, misunderstood, facing wrongful diagnosis, and the daily coping challenges with their conditions. Dr. Daniel explored, defined, and identified quality of life indicators, examining the different tools to measure and explore techniques on how to measure a patient's quality of life. She shared a deeper dive into the Berkeley Wellbeing Survey and how it is useful to assess a patient's strengths. Dr. Daniel emphasizes it is about listening to the patient about their priorities and significant areas for improving wellness. The physical, psychological, social, economic, and environment all contribute to well-being, and taking the time to explore the challenging areas is necessary. Essentially, work effectively to support patients with complex needs so that well-being is a priority. We thank our speakers for joining us today to collaborate to increase the knowledge to motivate further research for the best health outcomes for this community. EDS Canada Foundation recognizes the importance of healthcare providers sharing essential knowledge and continues to emphasize interdisciplinary participation to translate and mobilize this knowledge and make it accessible. Thank you sincerely for the work that you are doing and for sharing it with us today. Now, this ends the patient viewing portion of our event before we head into the roundtable discussion. Thank you to patients, our clients, and family members for joining today and for your engagement over the years to share your lived experiences and elevate knowledge for improved complex population health. Please share any questions you may have with education@ilcedscanada.org and provide your feedback and suggestions on how to improve our educational offerings on the evaluation form in the link provided.